A new nurse is caring for an adolescent transgender client. What question would be appropriate when assessing the client's gender identity? Do you prefer being referred to as he or she? How would you describe your gender? What gender were you originally? What is your preferred name? A new nurse is caring for an adolescent transgender client. What question would be appropriate when assessing the client's gender identity? Do you prefer being referred to as he or she? How would you describe your gender? What gender were you originally? What is your preferred name? A new nurse is caring for an adolescent transgender client. What question would be appropriate when assessing the client's gender identity? Transgender clients may fear judgment or embarrassment and withhold information, avoid seeking treatment, or refuse care as a result. This is often related to past experiences of discrimination or stigma when receiving health care. Therefore, it is important to use therapeutic communication and avoid stereotypes to establish trust. Transgender clients may identify as male or female or as neither or both genders. It is important for the nurse to determine clients' gender identity by asking open-ended questions that allow clients to explain their identities in their own words. Option 2. Option 1. The client may not identify as simply male or female. Asking closed-ended questions, e.g., whether the client prefers he or she, does not allow for client elaboration. Option 3. Because the client does not identify with a gender designated at birth, referring to a transgender client's original gender may cause distress and discomfort. The nurse should instead ask what sex the client was assigned on the original birth certificate. Option 4. Asking, "What is your preferred name?" is not open-ended and does not thoroughly assess gender identity. However, the client's preferred and legal names may be different. The nurse should use the client's preferred name to show respect and to develop a therapeutic relationship. Educational objective: transgender clients may identify as male or female or as neither or both genders. The nurse should use open-ended questions that allow clients to explain their identities in their own words. The healthcare provider prescribes clomiphene for 5 days beginning on the 5th day of menses for treatment of infertility. After, the nurse provides medication teaching, which client statement would indicate a need for further teaching. Clomiphene increases my risk of having more than one baby, such as twins or triplets. Hot flashes, mood swings, nausea, and headache are possible side effects of this medication. My partner and I should have sexual intercourse on the days that I am taking the medication. This medication will help my body release eggs and increase my chance of becoming pregnant. The healthcare provider prescribes clomiphene for 5 days beginning on the 5th day of menses for treatment of infertility. After, the nurse provides medication teaching, which client statement would indicate a need for further teaching. Clomiphene, Clomid, Serafine, is a selective estrogen receptor modulator that is used as a first-line treatment for infertility for women and works by stimulating ovulation. This medication blocks estrogen receptors in the hypothalamus and pituitary, which causes the release of hormones, i.e. gonadotropin-releasing hormone, follicle-stimulating hormone, luteinizing hormone, that stimulate the ovaries to release an egg. The medication is taken orally for 5 days early in the menstrual cycle, e.g., beginning on days 3 to 5 of menses. Ovulation typically occurs 5 to 9 days after completing the medication. Therefore, it is necessary for the client to understand the importance of engaging in frequent sexual intercourse, e.g., every other day for 1 week, 5 days after completing the medication for the best chance of successful conception. Option 3. Option 1. One of the risks of taking clomiphene is that more than one ovarian follicle sometimes develops, causing 2 or more eggs to be released, which may result in multiple gestation. Option 2. Mood swings, nausea, hot flashes, and headaches are common side effects associated with clomiphene. Option 4. This statement shows correct understanding of how clomiphene works. Educational objective: clomiphene is an infertility treatment for women that works by stimulating ovulation. It is necessary to engage in frequent sexual intercourse 5 days after completing the medication regimen. Clomiphene may cause mood swings, nausea, hot flashes, and headaches and increases the risk of multiple gestation. The registered nurse is caring for multiple clients on a medical surgical unit and has finished the morning assessment. Which task is appropriate for the nurse to delegate to unlicensed assistive personnel? Apply a collagenase dressing to a client's pressure ulcer for wound debridement. Assist a client 1 day post-operative hip fracture repair to the bathroom. Feed a client through a gastrostomy tube after elevating the head of the bed. Offer orange juice to a client if the blood glucose level is less than 70 mg per deciliter, less than 3.9 mmol/L. The registered nurse is caring for multiple clients on a medical surgical unit and has finished the morning assessment. Which task is appropriate for the nurse to delegate to unlicensed assistive personnel? Scope of practice: RN, LPN, LVN, UAP. 1. Clinical assessment. 2. Initial client education. 3. Discharge education. 4. Clinical judgment. 5. Initiating blood transfusion. 1. Monitoring RN findings. 2. Reinforcing education. 3. Routine procedures, e.g., catheterization. 4. Most medication administrations. 5. Ostomy care. 6. Tube patency and enteral feeding. 7. Specific assessments. 1. Activities of daily living. 2. Hygiene. 3. Linen change. 4. Routine, stable vital signs. 5. Documenting input-output. 6. Positioning. Limited assessments, e.g., lung sounds, bowel sounds, neurovascular checks. LPN equals licensed practical nurse, LVN equals licensed vocational nurse, RN equals registered nurse, UAP equals unlicensed assistive personnel. Delegation is the process of transferring responsibility of performing a task while maintaining the ultimate responsibility for the action and its outcome. The registered nurse, RN, should take into account the 5 rights of delegation: right task, right person, right circumstances, right communication, direction, and right supervision, evaluation, and the scope of practice when deciding which tasks to delegate. The unlicensed assistive personnel, UAP, can assist clients out of bed or to the bathroom, assist with activities of daily living, and position clients. The RN is responsible for assessing the client and adhering to the nursing process. Option 1. Debridement of a wound involves removing debris or dead tissue to convert contaminated wounds into clean wounds so that normal healing can take place. Dressing, e.g. collagenase changes for debridement, require sterile technique. UAP can change dressings only for chronic wounds using clean technique. Option 3. The UAP can elevate the head of the bed when a client receives enteral nutrition to prevent aspiration. However, feeding through a gastrostomy tube cannot be delegated to the UAP as it requires assessment of tube placement and aspiration of gastric residual volume. Option 4. Offering orange juice is an intervention for treating hypoglycemia that is outside the UAP scope of practice. The UAP should report the blood glucose level to the RN so that the RN can first reassess the client for accompanying symptoms of hypoglycemia. These would require RN assessment and interpretation before intervention. Educational objective: the registered nurse may delegate components of care but not parts of the nursing process itself, e.g., assessment, planning, evaluation, nursing judgment. The nurse prepares to administer a cleansing enema to a client with constipation. Which interventions are appropriate? Select all that apply. Assist the client into left lateral position with right knee flexed. Encourage the client to retain the enema for as long as possible. Insert tubing into the rectum with a tip directed toward the umbilicus. Keep the enema solution refrigerated until ready to administer. Slow administration rate if the client reports abdominal cramping. The nurse prepares to administer a cleansing enema to a client with constipation. Which interventions are appropriate? Select all that apply. Cleansing enemas, e.g., normal saline, soap suds, tap water, relieve constipation by stimulating intestinal peristalsis. When administering an enema, appropriate interventions include: 1. Place the client in a left lateral position with the right knee flexed, i.e., Sims position to promote flow of the enema into the colon, option 1. 2. Hang the enema bag no more than 12 and 30 centimeters above the rectum to avoid overly rapid administration. 3. Lubricate the enema tubing tip and gently insert 3 to 4 in 7.6 to 10 centimeters into the rectum. 4. Direct the tubing tip toward the umbilicus, i.e., anteriorly, during insertion to prevent intestinal perforation, option 3. 5. Encourage the client to retain the enema for as long as possible, e.g., 5 to 10 minutes, option 2. 6. Open the roller clamp on the tubing to allow the solution to flow in by gravity. If the client reports abdominal cramping, use the roller clamp to slow the rate of administration, option 5. Option 4. Enemas are administered at room temperature or warmed, as cold enema solutions cause intestinal spasms and painful cramping. Enemas may be warmed by placing the container of solution in a basin of hot water. Educational objective: when administering an enema, the nurse should place the client in the left lateral position with the right knee flexed. Insert the tubing into the rectum with a tip directed toward the umbilicus, and slow the rate of administration if the client reports abdominal cramping. Enemas should be administered at room temperature or warmed. A nurse in an urgent care center triages multiple clients. Which client should the nurse assess first? Client who reports nosebleed that has not resolved after holding pressure for 1 hour. Client who reports sinus congestion with thick nasal drainage and severe facial pain. Client with a sore throat who reports difficulty in opening mouth and swallowing. Client with seasonal allergies who reports new onset of unilateral ear pain and pressure. A nurse in an urgent care center triages multiple clients. Which client should the nurse assess first? Peritonsillar or retropharyngeal abscess is a serious complication that can result from tonsillitis or pharyngitis. The presenting features of peritonsillar abscess, in addition to fever, include a hot potato, muffled voice, trismus, inability to open the mouth, pooling of saliva, drooling, and deviation of the uvula to one side. The abscess can progress to life-threatening airway obstruction, e.g., dysphagia, stridor, restlessness. The nurse should immediately assess the client with symptoms of peritonsillar abscess and monitor for signs of airway obstruction. Option 3. Option 1. A client with epistaxis, i.e., nosebleed, that does not resolve with external pressure will require further hemostatic interventions, such as cauterization or nasal packing, e.g., gauze, nasal tampon, balloon catheter. This client should be assessed after the client with signs of impending airway obstruction. Option 2. Symptoms of acute sinusitis include severe facial pain, nasal congestion with purulent nasal drainage, and fever. In most cases, the etiology is viral but can be complicated by secondary bacterial infection. This client likely requires antibiotics and supportive care but is not the priority. Option 4. Acute otitis media, i.e., infection of the middle ear, may develop secondary to rhinitis, e.g., common cold, seasonal allergies due to inflammation of the eustachian tube. This client with otitis media will likely require antibiotics and pain management but is not the priority. Educational objective: peritonsillar abscess is an emergent complication of tonsillitis that can lead to life-threatening airway obstruction. Symptoms of peritonsillar abscess include fever, trismus, inability to open the mouth, drooling, muffled voice, and deviation of uvula to one side. The nurse is preparing to flush a client's central venous catheter. Which size syringe is best for the nurse to choose? The nurse is preparing to flush a client's central venous catheter. Which size syringe is best for the nurse to choose? Flushing the lumen of a central venous access device, central venous catheter, CVC, with normal saline is recommended to assess patency before medication infusion, prevent medication incompatibilities after infusion, and prevent occlusion after blood sampling. A 10 ml syringe is generally preferred for flushing the lumen of a CVC. Option 3. The smaller the syringe, the greater the amount of pressure per square inch exerted during injection, increasing the risk for damage to the CVC. The push-pause method involves slowly injecting normal saline into the CVC catheter and stopping for any resistance. Injecting against resistance can damage the CVC, which may result in complications, including embolism and malfunction. The nurse should always consult the specific manufacturer guidelines and facility policy when caring for a CVC. Options 1 and 2. A smaller syringe, e.g., 1 ml, 3 ml, creates more pressure, which increases the risk for damage to the CVC. Option 4. A 30 ml syringe is unnecessarily large to flush a CVC. Educational objective: when flushing the lumen of a central venous catheter, the nurse should use the safest syringe possible in the push-pause method to avoid exerting too much pressure, which may damage the catheter. The smaller the syringe, the greater the amount of pressure exerted during the flush. A 10 ml syringe is generally recommended, however, it is also important to consult the manufacturer's guidelines. The nurse assesses pitting edema of the extremities, dyspnea, bilateral crackles posteriorly, and a serum sodium level of 130 MEq/L, 130 mmol/L, in a client with chronic heart failure. The nurse should question which prescription. Furosemide 20 mg IV push twice daily. Maintenance IV line of 0.9%, normal saline at 85 ml per hour. potassium chloride 20 mEq orally twice daily. Sodium-restricted diet. The nurse assesses pitting edema of the extremities, dyspnea, bilateral crackles posteriorly, and a serum sodium level of 130 mEq, Fel, 130 mmol, Fel, in a client with chronic heart failure. The nurse should question which prescription. Chronic heart failure involves the inability of the heart to fill and pump blood effectively to meet the body's oxygen demands. As a result, clients can develop dilutional hyponatremia, serum sodium less than 135 mEq, Fel, 135 mmol, L, an electrolyte disturbance caused by an excess of total body water in relation to total sodium content. The nurse should question the prescription for the maintenance IV line. An infusion of an isotonic solution of 0.9% normal saline at 85 ml per hour is contraindicated in this client as it would increase the circulating extracellular fluid volume, worsen the symptoms, and exceed the less than 2 L per day fluid restriction, i.e., 85 ml times 24 hours equals 2040 ml. Converting the running IV line to a lock for medication administration would be appropriate. Option 1. Furosemide, Lasix, is a fast-acting loop diuretic prescribed to decrease preload in clients with heart failure who are fluid overloaded and experiencing manifestations of pulmonary congestion, e.g., crackles, dyspnea. Appropriate diuresis in this client would remove excess free water and correct dilutional hyponatremia. Option 3. Potassium chloride is administered to clients receiving furosemide to prevent or treat diuretic-associated hypokalemia. The nurse should not question this prescription. Option 4. Fluid restriction is prescribed to correct dilutional hyponatremia, a sodium less than 135 mEq, Fel, 135 mmol, Fel, in a client with heart failure. In addition, all heart failure clients require a low-salt diet. Excess salt causes retention of more water. This client's low sodium is due to excess free water and not to low dietary sodium. Educational objective. Dilutional hyponatremia, serum sodium less than 135 mEq, Fel, 135 mmol, Fel, is an electrolyte disturbance caused by an excess of total body water in relation to total sodium content and can occur in clients with heart failure. Treatment includes the administration of diuretics and fluid salt restriction. The nurse is working in a busy emergency department and is assigned 4 clients. Which client should the nurse see first? Client receiving cyclophosphamide reporting bloody urine. Client who reports severe nausea and vomiting after chemotherapy. Client with an elbow abrasion and a lip laceration possibly requiring sutures. Homeless client who appears drowsy with a temperature of 95 F35C. The nurse is working in a busy emergency department and is assigned 4 clients. Which client should the nurse see first? The client with a low body temperature and drowsiness needs immediate intervention to prevent and/or reverse physiologic compromise. Signs of hypothermia include a core temperature, e.g., rectal, less than 95 F35C, mental status changes, shivering, and impaired coordination. Alterations in acid-base balance, coagulation values, and cardiac function may also occur. Hypothermia can lead to cardiac and respiratory failure and coma. Option 4. Homeless clients are at higher risk for hypothermia from exposure to the elements, infections, and poorly managed chronic health conditions. The nurse should anticipate a workup for sepsis and various types of shock, in addition to environmental factors, while addressing this client's hypothermia. Option 1. Hemorrhagic cystitis, e.g., bladder inflammation, is a well-known complication of cyclophosphamide, immunosuppressant and chemotherapy agent. The client is instructed to drink plenty of fluids. This client may need IV hydration and other preventive measures, e.g., mesotherapy. Bleeding is usually minimal and occasionally requires a blood transfusion, but is rarely life-threatening. Option 2. Nausea and vomiting are expected side effects after chemotherapy. This client needs IV access established if the chemotherapy port cannot be accessed to address the nausea and prevent dehydration. However, this client would not take priority. Option 3. This client needs to have all wounds cleaned and irrigated prior to suturing, but would not take priority. Educational objective: hypothermia is a medical emergency that requires immediate intervention, including monitoring, rewarming, and supportive care. Hemorrhagic cystitis, e.g., bladder inflammation, is a well-known complication of cyclophosphamide. The hospice nurse is caring for an actively dying client who is unresponsive and has developed a loud rattling sound with breathing, death rattle, that distresses family members. Which prescription would be most appropriate to treat this symptom? Atropine sublingual drops, lorazepam sublingual tablet, morphine sublingual liquid, ondansetron sublingual tablet. The hospice nurse is caring for an actively dying client who is unresponsive and has developed a loud rattling sound with breathing, death rattle, that distresses family members. Which prescription would be most appropriate to treat this symptom? The death rattle is a loud rattling sound with breathing that occurs in a client who is actively dying. When the client cannot manage airway secretions, the movement of these secretions during breathing causes a noisy rattling sound. This can distress family and friends at the bedside of the dying client. The death rattle can be treated using anticholinergic medications to dry the client's secretions. Medications include atropine drops administered sublingually or a transdermal scopolamine patch. Option 2. Lorazepam is a benzodiazepine that is used to treat anxiety and restlessness in terminally ill clients. A major earthquake has occurred. Local gas lines and water pipes are breaking with resulting fires and flooding in collapsed buildings. Multiple victims arrive at the triage area. Which client should the nurse care for first? Client with charred, leathery skin over entire back, chest, and legs. Client with cool skin, shivering from sitting in water until rescued. Client with diabetes who was unable to take prescribed insulin today. Client with high-pitched, crowing inspiratory respirations. A major earthquake has occurred. Local gas lines and water pipes are breaking with resulting fires and flooding in collapsed buildings. Multiple victims arrive at the triage area. Which client should the nurse care for first? Disaster triage is based on the principle of providing the greatest good for the greatest number of people. Clients are triaged rapidly using a color-coded system to categorize them from highest medical priority, emergent to lowest, expectant. The client with stridor, e.g., high-pitched crowing inspiratory respirations, which typically occurs from constricted or blocked upper airways, is at risk for impending respiratory failure due to a compromised airway. This client should be classified as emergent, requiring immediate treatment and possibly prophylactic intubation. Option 4. Option 1. Using the rule of nines, clients with full-thickness burns to the chest, back, and legs are suspected to have at least 72% total body surface area burns and should be classified as expectant, black tag. Option 2. Clients with wet clothing or cold water immersion are at risk for hypothermia but can be easily self-managed by provision of warm, dry blankets. This client should be classified as non-urgent green tag. Untreated hypothermia may lead to decreased cerebral metabolism, dysrhythmias, and coagulopathies. Option 3. Clients with diabetes mellitus who are unable to receive insulin may develop hyperglycemia, which is unlikely to cause rapid deterioration. This client can perform self-care and should be classified as non-urgent green tag. Educational objective during mass casualty events, the goal is the greatest good for the greatest number of people. Clients are triaged rapidly using a color-coded system that categorizes them from highest medical priority to lowest: red, emergent; yellow, urgent; green, non-urgent; and black, expectant. A healthy 50-year-old client asks the nurse, "What must I do in preparation for my screening colonoscopy?" Which statements by the nurse correctly answer the client's question? Select all that apply. No food or drink is allowed 8 hours prior to the test. Prophylactic antibiotics are taken as prescribed. Smoking must be avoided after midnight. The day prior to the procedure, your diet will be clear liquids. You will drink polyethylene glycol as directed the day before. A healthy 50-year-old client asks the nurse, "What must I do in preparation for my screening colonoscopy?" Which statements by the nurse correctly answer the client's question? Select all that apply. Colonoscopy evaluates colonic mucosa. Therefore, clients should follow instructions to keep the colon clean with no stool left for better visualization during the procedure. These instructions include: 1. Clear liquid diet the day before. 2. Nothing by mouth 8 to 12 hours prior to the examination. 3. The healthcare provider prescribes a bowel cleansing agent such as a cathartic, enema, or polyethylene glycol golightly the day before the test. The type of prep depends on the healthcare provider's preference and client health status. Option 2. Healthy clients screened for colon disease do not require antibiotics prior to the procedure. Option 3. The instructions prior to a nuclear gastric emptying scan include teaching the client to avoid smoking the day of the examination as delay of gastric emptying occurs with tobacco use. Smoking cessation per se has no role in colonoscopy, but it is good for general health. Educational objective instructions for clients scheduled for a colonoscopy include a clear liquid diet the day before the procedure. Avoiding any food or liquids, nothing by mouth 8 to 12 hours prior to the examination, and taking the bowel cleansing agent as prescribed. The nurse is caring for a young adult who is considering becoming pregnant. The client expresses concern, stating, "One of my parents has Huntington disease, and I am afraid my child will get it." How should the nurse respond? Genetic counseling is recommended. You will receive a referral before you leave. Huntington disease inheritance requires both biological parents to carry the gene. There are other ways to grow your family. You should consider adoption. This disease occurs spontaneously and is not likely to affect your children. The nurse is caring for a young adult who is considering becoming pregnant. The client expresses concern, stating, "One of my parents has Huntington disease, and I am afraid my child will get it." How should the nurse respond? Huntington disease (HD) is an incurable autosomal dominant hereditary disease that causes progressive nerve degeneration, which results in impaired movement, swallowing, speech, and cognitive abilities. Chorea, involuntary, tic-like movement, is a hallmark sign. The onset of active disease is usually at age 30 to 50, and death from neuromuscular and respiratory complications typically occurs within 20 years of diagnosis. HD is confirmed by genetic testing. Clients who have a parent with HD and are considering having biological children should receive genetic counseling. Option 1. Option 2. Autosomal dominant traits require only one copy of the affected gene from one carrier parent to manifest, e.g., cause disease. Option 3. Although adoption may be considered, the nurse's opinion is not appropriate or therapeutic for the client. After genetic testing and further education from a genetic counselor, the client can make an informed decision about starting a family. Option 4. HD is hereditary, not spontaneous. The offspring of a client with the HD gene have at least a 50% chance of inheritance. Educational objective: Huntington disease is an incurable autosomal dominant disease that causes progressive nerve degeneration, which impairs movement, swallowing, speech, and cognitive abilities. Death typically occurs within 20 years. Clients who have a parent with this disease should receive genetic counseling, especially when planning to start a family. The nurse teaches safety precautions of home oxygen used to a client with emphysema being discharged with a nasal cannula and portable oxygen tank. Which client statement indicates the need for further teaching? Select all that apply. I can apply Vaseline to my nose when my nostrils feel dry from the oxygen. I can cook on my gas stove as long as I have a fire extinguisher in the kitchen. I can increase the liter flow from 2 to 6 liters a minute whenever I feel short of breath. I should not polish my nails when using my oxygen. I should not use a wool blanket on my bed. The nurse teaches safety precautions of home oxygen used to a client with emphysema being discharged with a nasal cannula and portable oxygen tank. Which client statement indicates the need for further teaching? Select all that apply. Oxygen is a colorless, odorless gas that supports combustion and makes up about 21% of the atmosphere. Oxygen is not combustible itself, but it can feed a fire if one occurs. When using home oxygen, safety precautions are imperative. 1. Vaseline is an oil-based, flammable product and should be avoided. A water-soluble lubricant may be used instead. 2. Oxygen canisters should be kept at least 5 to 10 feet away from gas stoves, lighted fireplaces, wood stoves, candles, or other sources of open flames. Clients should use precautions as cooking oils and grease are highly flammable. 3. The prescribed concentration of oxygen, usually 24%-28% for clients with COPD, should be maintained. Oxygen is prescribed to raise the PaO2 to 60 to 70 mm Hg and the saturations from 90% to 93%. A flow rate of 2 L per minute provides approximately 28% oxygen concentration, and 6 L per minute provides approximately 44%. Higher rates usually do not help and can even be dangerous in clients with COPD as they can decrease the drive to breathe. The client should notify the care provider about excessive shortness of breath as additional treatment may be indicated. Option 4. The client understands that nail polish remover and nail polish contain acetone, which is highly combustible. Option 5. Clients should avoid synthetic and wool fabrics because they can cause static electricity, which may ignite a fire in the presence of oxygen. Clients should use cotton blankets and wear cotton fabrics. Educational objective: safety precautions for home oxygen use include the following: no smoking, electrical devices in good condition and plugs grounded, avoiding volatile, flammable products and materials that generate static electricity. staying at least 5 to 10 feet away from open sources of flame, keeping fire extinguishers readily available, and regularly testing smoke detectors. The nurse is providing post-operative care to a client returning from a hemorrhoidectomy. Which action is the priority for the nurse to perform? Administer Docusate and teach the client to avoid straining during defecation. Give pain medications and instructions related to pain control. Remove the rectal dressing and check the client for bleeding. Teach the client how to self-administer a Sitz bath 2 to 3 times daily. The nurse is providing post-operative care to a client returning from a hemorrhoidectomy. Which action is the priority for the nurse to perform? Hemorrhoids, distended, inflamed veins located in the anus or lower rectum, are caused by increased anorectal pressure, straining to defecate, constipation. Clients may experience symptoms such as rectal bleeding, pain, pruritus, and prolapse. Although removal of hemorrhoids, hemorrhoidectomy, is a minor procedure, the pain associated with it is due to spasms of the anal sphincter and is severe. Nursing management for the post-hemorrhoidectomy client includes the following. 1. Pain relief. Initially, pain is managed with pain medications, including nonsteroidal anti-inflammatory drugs, e.g., ibuprofen, and acetaminophen. Opioids can be prescribed initially but may worsen constipation. Beginning 1 to 2 days post-operatively, warm Sitz baths are used as a means to relieve pain. Clients often dread their first bowel movement due to severe pain with defecation. Therefore, pain must be appropriately controlled to prevent further constipation. Option 2. 2. Preventing constipation. Encourage a high-fiber diet and adequate fluid intake, at least 1,500 milliliters per day. Administer a stool softener such as Docusate Collis as prescribed. An oil retention enema may be used if constipation persists for 2 to 3 days. Option 1. Option 3. Postoperatively, the healthcare provider may pack the rectum and apply a T-binder to hold the packing in place. The dressing is usually removed 1 to 2 days postoperatively unless excess soaking is noted before. Option 4. Warm Sitz baths are used beginning 1 to 2 days postoperatively, 2 to 3 times daily, 15–20 minutes each for 7 to 10 days to provide pain relief, decrease swelling, and cleanse the rectal area. Educational objective. Post-hemorrhoidectomy pain is excruciating. Providing pain relief and preventing constipation are the primary goals for these clients. Sitz baths should begin 1 to 2 days postoperatively. Hemorrhoids may recur with increased anorectal pressure. Therefore, clients should maintain a high-fiber diet, use stool softeners, and drink adequate fluids, at least 1,500 milliliters per day, to prevent constipation. A client with type 2 diabetes, coronary artery disease, and peripheral arterial disease developed hospital-acquired pneumonia (HAP) and has been receiving intravenous IV antibiotics for 4 days. Which parameter monitored by the nurse best indicates the effectiveness of treatment? Color of sputum, lung sounds, saturation level, white blood cell count (WBC). A client with type 2 diabetes, coronary artery disease, and peripheral arterial disease developed hospital-acquired pneumonia (HAP) and has been receiving intravenous IV antibiotics for 4 days. Which parameter monitored by the nurse best indicates the effectiveness of treatment? HAP is a bacterial infection acquired in a healthcare facility that was not present on admission. Almost all clients with bacterial pneumonia develop leukocytosis (WBC) greater than 11,000 per milliliter. Antibiotic therapy is the first-line treatment, but antibiotic resistance frequently occurs in HAP. If antibiotic therapy is effective, clinical improvement usually occurs within 3 to 4 days of initiation of IV antibiotics. The nurse monitors WBC as the best indicator of treatment effectiveness, as antibiotics cause bacterial lysis or hinder bacterial DNA reproduction. The reduced number of bacteria and the resulting decrease in inflammation cause a decrease in the number of white blood cells needed to fight the infection. Other indicators of treatment effectiveness include improvement of infiltrates on chest X-ray, oxygenation, and signs and symptoms: cough, fever, sputum production. Option 1. The color of sputum, e.g. clear, yellow, green, gray, rusty, blood-tinged, can vary with different types of pneumonia. It is not the best indicator of treatment effectiveness. Option 2. Adventitious, abnormal lung sounds: crackles, low-pitched wheeze, bronchial breath sounds can be present as the pneumonia resolves or can be a sign of further complication, pleural effusion. However, these are not the best indicators of treatment effectiveness. Option 3. Saturation is an indicator of oxygenation but can be affected by many other factors, such as coexisting disease, peripheral circulation, and drugs. It is not the best indicator of treatment effectiveness. Educational objective indicators of treatment effectiveness for HAP include decreased WBC on complete blood count with differential and improvement of infiltrates on chest X-ray, oxygenation, and signs and symptoms: cough, fever, sputum production. Exhibit. The nurse is caring for a 72-year-old client with hypothyroidism admitted to the emergency department for altered mental status. The client lives alone but has not taken medications or seen a healthcare provider for several months. Which action is the priority? Click on the Exhibit button for additional information. Administer IV levothyroxine. Check serum TSH, triiodothyronine, and thyroxine. Place a warming blanket on the client. Prepare for endotracheal intubation. Exhibit. The nurse is caring for a 72-year-old client with hypothyroidism admitted to the emergency department for altered mental status. The client lives alone but has not taken medications or seen a healthcare provider for several months. Which action is the priority? Click on the Exhibit button for additional information. Clinical features of Myxodemocoma. 1. Hypothermia. 2. Hypoventilation. 3. Bradycardia. 4. Hyper or hypotension with narrow pulse pressure. 5. Decreased mental status, psychosis, seizure and coma. 6. Non-pitting edema of hands, face and tongue. 7. Pericardial effusion. 8. Hyponatremia and hypoglycemia. 9. Possible concurrent adrenal insufficiency or hypothalamic pituitary dysfunction. Myxodemocoma refers to a state of severe hypothyroidism causing decreased level of consciousness, e.g., lethargy, stupor, that may progress to a comatose state. Myxodemocoma is characterized by hypothermia, bradycardia, hypotension, and hypoventilation. Hypoventilation may occur as a result of respiratory muscle fatigue and mechanical obstruction by an edematous tongue. Clients with signs of respiratory failure, e.g., slow or shallow breathing, low oxygen saturation, require emergency endotracheal intubation and mechanical ventilation. The nurse should provide respiratory support, e.g., ventilation with a bag valve mask, and prepare to assist with intubation. Option 4. Option 1. Clients with myxodemocoma require thyroid hormone replacement with IV levothyroxine to correct the hypothyroid state, but only after respiratory status is secured. Improvement in clinical status may not occur for up to a week after initiation of hormone replacement. Option 2. A serum thyroid panel, e.g. TSH, triiodothyronine, thyroxine, is required to confirm hypothyroidism, and these measurements should be monitored during treatment. However, the nurse should ensure that the client is stable before reviewing laboratory values. Option 3. A warming blanket should be placed on the client to treat hypothermia. However, respiratory support is the priority. Educational objective: Myxodemocoma is a state of severe hypothyroidism and decreased level of consciousness that may progress to coma and respiratory failure. The nurse should provide respiratory support, e.g., ventilation with a bag valve mask, and prepare to assist with intubation. A nurse is assessing a 58-year-old client with blurred vision and reduced visual fields. Which manifestation is of most concern to the nurse? Difficulty adjusting to dimmed lights. Extreme eye pain. Gradual loss of peripheral vision. Opaque appearance of lens. A nurse is assessing a 58-year-old client with blurred vision and reduced visual fields. Which manifestation is of most concern to the nurse? Acute angle closure glaucoma is a form of glaucoma that requires immediate medical intervention. Glaucoma disorders are characterized by increased intraocular pressure, IOP, due to decreased outflow of the aqueous humor, resulting in compression of the optic nerve that can lead to permanent blindness. In acute angle closure glaucoma, IOP increases rapidly and drastically, which can lead to the following manifestations. 1. Sudden onset of severe eye pain. 2. Reduced central vision. 3. Blurred vision. 4. Ocular redness. 5. Report of seeing halos around lights. Options 1 and 3. Gradual loss of peripheral vision and difficulty adjusting to different lighting are manifestations of chronic open-angle glaucoma. Although further evaluation and treatment are necessary, this condition develops slowly and is not considered an emergency situation. Option 4. Opaque lenses are characteristic of cataracts, which are not a medical emergency. Educational objective: manifestations of acute angle closure glaucoma include sudden onset of severe eye pain, reduced central vision, blurred vision, ocular redness, and report of seeing halos around lights. This condition requires immediate medical intervention to reduce IOP and prevent permanent blindness. A 3-month-old who weighs 8.8 pounds, 4 kilograms, has just returned to the intensive care unit after surgical repair of a congenital heart defect. Which finding by the nurse should be reported immediately to the healthcare provider? Chest tube output of 50 milliliters in the past hour. Heart rate of 150 per minute. Temperature of 97.5 F 36.4 C. Urine output of 8 milliliters in the past hour. A 3-month-old who weighs 8.8 pounds, 4 kilograms, has just returned to the intensive care unit after surgical repair of a congenital heart defect. Which finding by the nurse should be reported immediately to the healthcare provider? Chest tubes may be placed during cardiac surgery to help drain fluid and air and to ensure room for lung expansion. The chest tube and chamber should be assessed every hour for color and quantity of drainage. Drainage greater than 3 milliliters per kilogram per hour for 3 consecutive hours or greater than 5 to 10 milliliters per kilogram in 1 hour should be reported immediately to the healthcare provider. Option 1. This could indicate post-operative hemorrhage and requires immediate intervention. Cardiac tamponade can develop rapidly in children and can be life-threatening. This child weighs 4 kilograms and an output of 50 milliliters in 1 hour is excessive. Option 2. For infants age 1 to 12 months, the normal heart rate is 90 to 160 per minute. Option 3. Hypothermia is common after surgery. Warmers may be used to correct the client's temperature. Option 4. Hourly urine output should be measured in the post-operative infant. A urinary catheter is often placed during surgery, allowing for accurate measurement. Urine output should be 1 to 2 milliliters per kilogram per hour. Educational objective: the nurse should immediately report chest tube drainage greater than 3 milliliters per kilogram per hour over 3 consecutive hours or greater than 5 to 10 milliliters per kilogram over 1 hour, which could indicate post-operative hemorrhage. Cardiac tamponade can occur rapidly in children and can be life-threatening. The nurse is performing visual acuity screenings on a group of students. Which of the following student comments does the nurse recognize as indicating possible myopia? Select all that apply. I can see my teacher better if I sit in the back of the classroom. I have to hold my book close to my face so that the words are clear. If I squint or close one eye, I can read the road signs when we travel. My parents always tell me that I am sitting too close to the television. Sometimes, I have to ask my parents if I've chosen socks that match. The nurse is performing visual acuity screenings on a group of students. Which of the following student comments does the nurse recognize as indicating possible myopia? Select all that apply. Myopia, or nearsightedness, is reduced visual acuity when viewing objects at a distance. Myopia occurs when the eye structure causes images to focus before they arrive at the retina. Near vision is usually intact, and many clients with myopia report needing to hold objects near their face or sit near objects to see clearly. Options 2 and 4. Myopia in pediatric clients may first be discovered by the school nurse during routine visual acuity testing. Children often report headaches, dizziness, and the need to squint the eyes to see clearly. Option 3. School performance may be affected because of impaired ability to see class presentations. Option 1. Reduced visual acuity when viewing objects up close with intact distance vision is associated with hyperopia. Clients with hyperopia may report having to hold materials far away to read or sit at a distance to have clear vision. Option 5. Impaired ability to perceive and differentiate colors, e.g., red and green, blue and yellow, is associated with color vision deficiency, a congenital impairment of cone function in the retina. Children with color deficiency may have difficulty selecting matching clothing or appropriate colors for school assignments. Educational objective: myopia, or nearsightedness, is reduced visual acuity when viewing objects at a distance. Clients with myopia often need to hold objects near their face or sit near objects to see clearly. Myopia may lead to headache, dizziness, and decreased school performance from eye strain. The nurse in an outpatient clinic is caring for a client at 34 weeks gestation. The client is taking ferrous sulfate for anemia and reports constipation. Which of the following recommendations are appropriate for this client? Select all that apply. Consume dairy products with ferrous sulfate pills. Continue daily moderate intensity exercises. Increase intake of raw fruits and vegetables. Limit intake of coffee to 3 cups per day. Take a stimulant laxative daily for a week. The nurse in an outpatient clinic is caring for a client at 34 weeks gestation. The client is taking ferrous sulfate for anemia and reports constipation. Which of the following recommendations are appropriate for this client? Select all that apply. Constipation, a common discomfort of pregnancy, is often caused by increased progesterone levels and iron supplementation. Recommendations for preventing or treating constipation during pregnancy include the following. 1. Continuing regular moderate-intensity exercises, e.g., walking, swimming, aerobics, which stimulates peristalsis and promotes defecation. Option 2. 2. Increasing intake of high-fiber foods, e.g., raw fruits or vegetables, which promotes bowel movements by adding bulk to stool. Option 3. 3. Drinking adequate fluids, e.g., 2 to 3 L per day, which softens stool and allows it to pass more easily. Option 1. Dairy products, e.g., cheese, milk, are a great source of calcium, which is needed for fetal bone development. However, some dairy products, especially cheese, may worsen constipation. In addition, the nurse should recommend avoiding dairy products at least 2 hours before or 1 hour after taking iron supplements to prevent decreased iron absorption. Option 4. Although warm beverages, e.g., coffee, may stimulate a bowel movement for some clients, caffeine consumption during pregnancy should be limited to about 200 mg per day, e.g., 2 cups of brewed coffee. Option 5. Stimulant laxatives, e.g., bisacodyl, should not be taken daily during pregnancy due to the risk of dehydration, electrolyte imbalance, and uterine cramping or contractions. Daily stool softeners, e.g., docusate sodium, or bulk-forming laxatives, e.g., psyllium, are more appropriate during pregnancy, if required. Educational objective: constipation, a common discomfort of pregnancy, is often caused by increased progesterone levels and iron supplementation. Recommendations for treating constipation during pregnancy include regular moderate-intensity exercise, increasing intake of high-fiber foods, e.g., raw fruits and vegetables, and drinking adequate fluids.